Good afternoon, good morning, wherever you are. Welcome to this webinar celebrating the launch of the Mother's Milk Tool. I am Honorary Associate Professor Julie Smith from the Australian National University. Together with my colleagues Roger Mathisen and Duan Nguyen from Alive and Thrive Southeast Asia and Naomi Hull from the World Breastfeeding Trends Initiative Australia, we will chair and manage the webinar tonight. We're pleased to be supported by FHI Solutions, who've contributed important funding for the development of the Mother's Milk Tool. It's been a delight and a privilege to work with our colleagues at Alive and Thrive, who organised this important support for the tool and for the event. Roger will introduce Alive and Thrive in a moment. We're also grateful to our friends at the ANU Gender Institute and several mother support groups and networks, such as the Australian Breastfeeding Association, the Breastfeeding Promotion Network of India, Aragon from the Philippines, and the Indonesian Breastfeeding Mothers Association. Breastfeeding a mother's milk is presently not counted in food systems or the economy, and should be. The Mother's Milk Tool, we hope, will help. As many of us prepare to celebrate Mother's Day, we're looking forward tonight to hearing from an outstanding lineup of speakers on the Mother's Milk Tool. We'll introduce our speakers in a moment. Meanwhile, you will find a link to the detailed program and biographies of the speakers in the chat. Please introduce yourself there. We're recording the webinar and it will be on the webpage in due course. We're also going to hold a poll later in the webinar where you, our wonderful webinar participants, get to choose the logo for the tool. So stay around for a bit of excitement as well as some amazing presentations on the tool from around the world. Next slide, please, Naomi. Breastfeeding is part of our human cultural heritage, but it's been badly disrupted in many countries. This meeting is being hosted on the traditional lands of the Ngunnawal and Ngambri people. The Indigenous women of Australia have been living, working, birthing, breastfeeding and raising children successfully on this country for tens of thousands of years. Their skills and knowledge about safe infant and young child feeding, including breastfeeding and safe complementary feeding, has been key to their health and survival. We have much to learn from Indigenous women and history. Eminent historian Geoffrey Blaney has written about Indigenous Australians that a mother normally fed a child at the breast until the age of 3 or 4. Abandoned breastfeeding at an early age was risky. The alternative, animal's milk, was not available.
Thank you.
A long period of breastfeeding curbed the mortality of infants. A prolonged breastfeeding helped to space her births. The traditional emphasis, he said, on breastfeeding was a boon for the Aborigines. I've used the tool to estimate that Indigenous Australian women provided well over 2 million litres of milk and up to perhaps 7 million litres to their babies and children in 1788. However, nowadays our Indigenous Australian children are less likely to be breastfed at every age than non-Indigenous children, including in remote as well as urban locations. Little data has been collected on their breastfeeding practices and minimal resources have been invested in repairing the damage to this important traditional breastfeeding culture. We hope the tool can help make the case for such investment. I would now like us to acknowledge and celebrate the first Australians on whose traditional lands we meet and pay our respects to the elders past, present and emerging. I will now hand over to Roger Mathisen from Alive and Thrive.
Yeah, thank you, Julie. So welcome everyone to this exciting launch. It's an innovation, it's a global new tool called the Mother's Milk Tool. And I am Roger Mathisen. I'm the Regional Director for Alive and Thrive in Southeast Asia. And Alive and Thrive is an initiative to save lives, prevent illness, and ensure healthy growth and development of mothers and children. I'm also leading FHI Solutions Innovation Incubator. And FHI Solutions is a subsidiary of FHI 360, and it's an international non-profit supported by 3 centers of excellence, so Alive and Thrive, but also Intake and 1000 Days. As highlighted during the UN Food Systems Summit and also the related dialogues, breastfeeding and mother's milk is presently not counted for in food systems or the economy, and it should be. So this new mother's milk tool will help and hopefully help change that. So I'm very excited to see that so many colleagues and friends, participants are joining from around the world, and at a very relevant time when many countries are also celebrating Mother's Day. We are looking forward to hearing from you, and we are very grateful for your support, sharing information about this tool. The tool and the numbers it generates, it helps illuminate or put spotlights on the contributions by mothers to the economy and the society. And this powerful evidence can furthermore inform and trigger change in the enabling environment and supportive policies and practices. So you can start immediately. You can help with the dissemination and uptake of the tool by joining the conversation online. So you can use the social media kit we have prepared, and one of my colleagues are now sharing that in the chat box. Please use the hashtag Mother's Milk Tool in all your posts. That's our primary hashtag. So we are able to track the communication, but also take advantage of secondary kind of hashtags such as Mother's Day 2022 to ensure that we have a broader reach. And on the next slide, you can see the hashtag just as a reminder. And also please use our handles and tag us on Alive and Thrive, FHI Solutions, and Anu Pop Health. So thank you, and over to you, Naomi, unless you're already busy tweeting or maybe even on TikTok.
Actually, I'll just leave those there for a bit longer in case you need to jot them down. Thank you very much, Julie and Roger. This is a really exciting launch tonight. I'm here on the land of the Turrbal and the Yuggera people in Brisbane, Australia, and I pay my respects to their elders past, present and emerging. On behalf of the World Breastfeeding Trends Initiative Australia, I'm excited to be able to support this launch of the Mother's Milk Tool tonight. We're looking forward to seeing how this tool can be used by policymakers to include breast milk in their budgets, balance sheets and estimates. I hope it highlights the cost savings of ensuring that mothers are supported to reach their breastfeeding goals and the global nutrition target of 50% of babies exclusively breastfed to 6 months by 2025. Tools such as this play an important role in advocacy. This will add to the growing kit of tools that already includes the World Breastfeeding Trends Initiative tool and the World Breastfeeding Costing Initiative. These have already been used successfully for almost 2 decades now and are building a growing database that shows progress or lack thereof in over 100 countries across the globe. For tonight's webinar, we really do love to hear who's here with us and where you're from, so please use the chat to introduce yourselves. If you have any questions, they can also be added to the chat. And time permitting, we will endeavour to address some of those at the end of the session. Any questions that remain unanswered, we're hoping to put together a frequently asked questions document and we will be able to answer them for you there. We ask that conversation in the chat keeps on track and on topic and that it remains respectful. The chat will be monitored and we reserve the right to remove anyone from the webinar. Please keep your microphone off throughout the webinar to reduce noise and distractions. And it can also help to leave your video off as well. Just helps with bandwidth for everyone that's here. So moving along to our program, we have an awesome program tonight, a lot to get through. We'll do our best to stay on time. We'll be starting off with Professor Dame Waring, followed by Julie, and followed then by Alessandro Alamo. We will hear some user perspectives of the tool and some more speakers towards the end then. Dr. Phil Baker, Ms. Frances Knight, and then we'll be joined by Tuan from Alive and Thrive to do some Q&A and answer those questions that you've popped in the chat for us. We also have a poll at the end, so we hope you can stay with us through to the end. And I'm going to hand over to Julie now. Thanks very much, Julie.